Hi, everybody, and welcome. My name is Neil Seidman, and I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. Welcome to our webinar, CBT for Tinnitus Distress. And our presenter is Dr. Bruce Hubbard. Now, before we start, I just want to say just a word about ADAA, the Anxiety and Depression Association of America. ADAA was started back in 1979, and today it's the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, through practice and research. And we work to end stigma and to get the word out that these conditions are real, they're serious, and they're treatable. I want to invite everybody to visit the ADAA website. It's really a fantastic resource. It's adaa.org. You'll find a great list of treatment providers, and also there's a wonderful peer-to-peer online support group. So let's get started. I'm really happy to introduce our presenter. For over 20 years, Bruce Hubbard has helped people improve their lives with cognitive behavior therapy, that's CBT for short. He established one of the first cognitive behavioral practices in New York City. In 1999, he founded the Cognitive Health Group, where he pioneered the integration of CBT and mindfulness. In 2005, Dr. Hubbard himself developed severe tinnitus distress. His emotional struggle and his ultimate recovery led to his present mission to inform and educate consumers and professionals about CBT as a practical management for tinnitus. Dr. Hubbard is president of the New York City Cognitive Behavioral Therapy Association. He is also a visiting scholar at Columbia University Teachers College, and he's the director of the Cognitive Health Group on Manhattan's Upper West Side. Previously, he served as clinical instructor at NYU Medical Center. Dr. Hubbard has been quoted as an authority in many media outlets, including Shape, Real Simple, O, Maxim, the New York Post, and CNBC. He has published and presented papers on tinnitus distress, anxiety, depression, thought disorder, and integrative science-based mental health treatment. His professional work is further enhanced by his practical study of mindfulness meditation and yoga. So let me turn it over now to Dr. Hubbard.
Thank you, Neil. Thank you for inviting me, and thank you everyone who's worked on this, producing this webinar. Just get my slides in order there. I'm happy to have this opportunity to inform the world about a little-known emotional condition that affects as many as 1 in 20 Americans, tinnitus distress, and how to help people by using cognitive behavior therapy. As Neil said, I have tinnitus, and in 2005, when tinnitus burst into my world, I was in emotional trouble. As a 15-year veteran cognitive behavior therapist, I was hopeful to learn that CBT is the only proven treatment for tinnitus distress. That was 12 years ago. My tinnitus hasn't changed, but now I rarely notice it. And when I do, there's no emotional reaction. I forget about it just as quickly. My mission now is to inform the tinnitus community, health professionals, consumers, and their families about cognitive behavior therapy as an option for tinnitus. And I hope that this webinar will be helpful for people who are suffering with tinnitus distress now, and encourage health professionals to get involved in this really vastly underserved area. To make sure we're all on the same page, I'm going to start with a brief primer on tinnitus. Tinnitus is a persistent internal sound with no external source. Commonly known as ringing in the ears, although, as you'll learn, it's not just ringing tones people are hearing, but a wide range of sounds. And it's not just in the ears, but can be located in various places throughout the head. Tinnitus is a subjective phenomenon. With very few exceptions, no one else can hear your tinnitus. Studies show that up to 75% of people with tinnitus also have at least mild hearing loss. And most people don't know that 40% of people with tinnitus also have some degree of what's called sound sensitivity, a condition in which certain sounds produce uncomfortable sensations. We don't know what causes tinnitus internally, what exactly is happening in the ears or in the brain, but we have identified several external causes for tinnitus. Head injury can result in chronic tinnitus. And there's a small list of what are called autotoxic medications, that is, medications that can damage the inner ear and result in chronic tinnitus.
Could you give an example of a medication that are there common medications that do that?
You know, there are some common medications that can cause tinnitus, but it's reversible when you stop using them, and two of them are aspirin and ibuprofen. Those are probably the most common. But the medications that I'm referring to that actually can do permanent damage are certain antibiotics that are not routinely used.
I see.
Yeah, so it's not something that someone would tend to encounter.
So in a way, that's kind of like a traumatic experience that somebody might have where they react to a particular medication.
You know, that's a really good point, Neil, because there are a number of things like that, different types of audiology procedures and so on that occasionally go wrong and actually cause tinnitus. And when you see somebody like that, your heart really goes out to them. But as I was saying, the most common observation is that people with tinnitus tend to have a positive history of noise exposure. The one study showed that tinnitus is the highest cause of veteran-related service disability.
Wow. Could you repeat that? Tinnitus is the highest
cause of service-related disability in United States veterans. It's the exposure to the artillery.
I had no idea.
The artillery, the high volume of airplane engines flying in helicopters, things like that. Another study found that more than 60% of musicians have tinnitus. And my musician patients have told me we pretty much all have it, but everyone's not talking about it. Occupational noise exposure carries a 70% risk of developing tinnitus. And of course, similar levels of noise exposure occur through routine recreational activities. If you have tinnitus, you're not alone. As many as 1 out of 6 Americans has persistent tinnitus, making it a relatively common condition.
1 in 6. I had no idea it was that common.
It is, you know, the studies really vary, but this is the upper end of it. But it's very common. And this is just the United States. The figures are consistent worldwide. And tinnitus is considered to be a problem of aging. The incidence goes up considerably after age 40 to the point where 1 in 4 people over age 50 has chronic tinnitus. And unfortunately, we're seeing tinnitus in a younger generation. And we suspect that it's the advent of personal listening devices, in particular earbuds, which I'll talk about a little later. But I'm not here today to talk about tinnitus. I'm here to talk about tinnitus distress. Tinnitus distress is a persistent negative emotional reaction to tinnitus. Also known as bothersome tinnitus or intrusive tinnitus, I prefer to refer to it as tinnitus distress because that places the emphasis on the emotion and not on the characteristics of the tinnitus itself. And as we'll see, that's an important distinction for recovery.
So if I'm experiencing tinnitus where I'm hearing the sound because I had a trauma or a reaction or loud noises at my work, if I'm having distress to the point that it's interfering with my life, this is what you're going to be talking about.
Yes,
Okay.
absolutely. And this is a condition that's been around for a long time. It's well documented through history. It consists of emotional distress, which typically arises as anxiety, but for many people, tinnitus can open a Pandora's box of emotion. Irritability about being distracted and derailed, sadness on grieving the loss of a prior quality of hearing, guilt that you may have brought the problem on through exposure to loud activities, and shame that you, unlike others seem to do, can't just shrug tinnitus off.
So it's not just my anxiety, it's all these other distressing emotions. And so I think that's a really good name for this condition, tinnitus distress.
Yes, it's not fair to call it an anxiety condition. Some people, in fact, really will come and see me and say, I'm not really anxious, I'm upset, I'm angry about having to deal with this. And, the guilt and shame are really a large part of it for people who, like myself, who I played in rock and roll bands for years. And I'm, sure that maybe in combination with some genetic or congenital aspects in my auditory receptor system, that's what brought it on. That's what brought it to the fore. So it's very tough for people. That's part of the distress, is going through that self-acceptance and self-forgiveness that you may have done something to bring it on. And when your mind is constantly on tinnitus and on the emotion it's triggering, it's really hard to get your focus on anything else. Impaired concentration is one of the hallmarks of tinnitus distress. And at the end of the day, when you're not active and there's no distraction and you lay down to go to sleep, it's just you and your tinnitus. And it's common to just lay there awake, ruminating on the whole tragic symphony. That studies show that as many as 70% of people with tinnitus distress complain of sleep disturbance. And people with tinnitus distress develop a pattern where they avoid settings that they believe could make their tinnitus worse. And it could be settings you might consider loud, but it's not loud enough to cause any hearing damage. And because of this, they begin to withdraw from friends and family, from work settings, from a lot of settings that had been prior sources of meaning and value for them.
So at that point, it's really interfering with my life if I'm doing that to try as a way of coping, because I don't have any of these tools that you're going to introduce us to.
That's exactly right, yeah. And, that's where, as we'll see, you see the higher levels of distress is where you see greater levels of avoidance and withdrawal. As I'm saying, tinnitus distress ranges in severity. From mild, where someone is just distracted and annoyed, but they're still functioning effectively, to moderate, where they have impaired sleep or concentration and some degree of avoidance and withdrawal, to severe, which affects 3% of people with tinnitus distress, where you're completely hijacked by your tinnitus. It's really 24/7 on your mind. Sleep and concentration are impaired, and there's significant avoidance and withdrawal. So who gets tinnitus distress? Well, it's not everybody with tinnitus. And this is the high end of the estimate is about 1 out of 3 people with tinnitus develop some level of tinnitus distress. That's about 18 million Americans, or 5% of the population. So that's a lot of people who can potentially be disturbed by this. Tinnitus distress is strongly associated with common emotional conditions. One study showed that 45% of people with tinnitus distress had a diagnosable anxiety disorder, and 39% were diagnosed with depression.
And would you suspect that in a lot of these cases, the tinnitus distress came first?
That's a really good question. Very often when you do a thorough history, you find that there is a history of emotional disorder. There are some anxiety disorders that seem to lean more toward tinnitus as being a potent trigger, like obsessive compulsive disorder and health anxiety. And
So if
for
I already
some,
have an anxiety disorder or depression, and then I have tinnitus, then I'm probably a lot more likely to get tinnitus distress.
absolutely, yeah, that's the double whammy. And particularly for younger people who I've seen, tinnitus can be the entree to an emotional disorder. That can be the trigger that kind of gets them started with it. So again, from a preventative standpoint, it's just so important that we get them this treatment and help them understand, and develop a set of universal coping skills that they can use in the future with other triggers that could set off an emotional disorder. And it really emphasizes the importance of screening for and treating these conditions in this population. So how can such a seemingly small thing, a meaningless noise playing out in the head, cause so much pain and dysfunction? So I'd like to take a moment to convey just what people with tinnitus distress are hearing. Tinnitus is heard just like any other external sound, only it's located in the ears or somewhere in the head. It's constant or intermittent. And if it's intermittent, it can take a variety of forms. It can be lower in volume and then increase in volume over the course of a day. It can be completely absent for a day and then present for a couple of days. Different sounds can come and go. And this is a much more intermittent tinnitus, in some ways, much more difficult thing for people to cope with, because it really reinforces their hope that it's going to go away, or that it's going to reduce in volume and not go up again. So when it does go away or go down, they get that hope up, and when it comes back, they're just devastated all over again. The tinnitus sounds can be bilateral, heard on both sides of the head, or unilateral, heard on just one side of the head. If you have unilateral tinnitus, it's especially important that you have a thorough medical evaluation, as that could indicate a treatable condition.
Okay, so that's a good point, that if I'm noticing it only on one side, then that's could be an indication of something else going on that's contributing to it.
Yeah, that's correct.
I wanted to ask you, Dr. Hubbard, the pronunciation, because I started out saying tinnitus. Is either pronunciation acceptable?
It is, yeah. There's no correct way to say it. For some reason, medical professionals tend to say tinnitus, and consumers tend to say tinnitus. So I went from being a consumer and saying tinnitus to getting into the habit of tinnitus, but both are in common usage, and both are correct.
Okay, good, thanks.
Tinnitus is typically heard as a high-pitched tone. That's the most common sound that people report. However, there are a wide range of tinnitus sounds that people hear. Static, what they refer to as a roar, a whistle, a hiss, and chirping, or as I indicated, a combination of these sounds. Now, to really give folks a firsthand experience of what this sounds like, I'm going to play a demonstration of tinnitus sounds. because I don't know how these are going to come up on your device, I recommend that you take a moment to lower your volume, and then you can raise it up just to the level that seems reasonable for you.
I'll turn mine down just a little bit.
Okay.
But I'm not turning everybody else's down. So everybody that's watching this, maybe turn your volume on your computer or the device that you're watching this on. You can turn the volume down just a little bit, and then you can always turn it back up again.
Okay. Okay, here we go. This is tinnitus. Okay, I'll just give that a moment to sink in, and mute my phone in case it rings. Yeah, that's what people are hearing. The volume of tinnitus varies quite a bit from person to person. It's very difficult to get an objective measurement. Obviously, it's not an objective phenomenon, so it's a little bit hard to track how loud tinnitus really is for people. But that's what it sounds like. Now, you would think for something as common as and potentially disruptive as tinnitus, the medical community would have a treatment, something to soften the sound, reduce the volume, lower the frequency. Yet at present, tinnitus is not a treatable condition. There's no reliable method to change tinnitus characteristics like volume, frequency, pattern, or to turn tinnitus off.
So you're saying there's no medical treatment for the tinnitus itself, but what you're introducing us to is tools for the distress that
That's right.
yeah, and that's what's really interfering with our life. So what we want to get to is, well, I may still have the tinnitus, like you said, you still had the tinnitus.
Yeah.
It's not it doesn't affect your life anymore because you had tools to address the distress that it was giving you.
Well, that's right, and what I'm working up to is there's a condition that the brain can adapt to tinnitus through, and that's really primarily what we're trying to do with CBT, so I'm going to work up to that point.
Great.
But for many of us, myself included, this is the first time you hear your doctor utter the words, "Nothing can be done. You'll just have to live with it."
That's not reassuring.
No, it's not, and again, it's mildly traumatizing for people to be as upset as they are and go in and expect to come away with some kind of remedy and be told that there's nothing that can be done.
And when I'm going in to see my doctor, that's probably at a time that I'm feeling distressed.
Yeah. Yeah, okay. Absolutely. No, that really you hear often hear that story. People who are coming in for help that it made it much worse. And so part of my mission is to get the word out to ear, nose, and throat doctors who probably make 99% of the diagnoses of tinnitus on how to do it in a compassionate and effective manner. So you have the sounds of tinnitus. For many people, sensations, uncomfortable sensations, and for many others, some level of hearing loss that you're dealing with. This is persistent. What you're experiencing now is...
I'm sorry, when you say sensations, what are you referring to there?
Sound sensitivity is probably a variety of, like a range of conditions which have the common experience of being an uncomfortable sensation that's felt in the head or in the ears on hearing certain sounds.
I see.
Yeah, the most common form of it is called hyperacusis, which again, a large percentage of people with chronic tinnitus also have hyperacusis. And hyperacusis is a condition in which normal levels of sound are experienced as being too loud. And it tends to be high-pitched, clinky, sharp sounds. Like I have this condition as well, and for me, I first noticed it when I was putting dishes away at night. So it was the clanking of the dishes against one another that really triggered quite a bit of discomfort for me physically.
So I
Um,
might have all these things going on at the same time. The tinnitus sounds, like the samples that you played for us. I might also have that sound sensitivity to certain kinds of sounds that just are sound really, really loud. And I might also have some hearing loss, and all these things could be happening at the same time.
all at the same time, yeah. And it's persistent, what you're experiencing, whatever that medley of sensations and lack of sensations, whatever that is, it's likely to be with you for the rest of your life. And it's also, there's no treatment. It's completely uncontrollable. So with all that going on, it's not surprising that so many people have an emotional reaction. So now I'm going to share some numbers that I had alluded to earlier that are very important for people with tinnitus distress to understand and to remember. So I had referred to as high as a 33% of people with chronic tinnitus becoming distressed. That figure pertains to people who have a relatively recent onset of tinnitus. If you look at people a couple of years out, you see a very different number. You see that only about 2 to 3% are distressed. So this suggests that most people with tinnitus distress do eventually adapt to their tinnitus and even get to a point like me where they're no longer bothered. Their brains have learned to screen tinnitus out of awareness through a natural neurological process called habituation.
And that's just by living with it for a certain period of time.
Well, habituation is a natural process that tends to occur with tinnitus over about 6 to 18 months. So it does take time. It may happen sooner for people without tinnitus distress. There's no research out there that I'm aware of to look at the full range of people who get tinnitus to see kind of what their habituation curves look like. But for people with tinnitus distress, it tends to take about 6 to 18 months. It's based on this process that we can experience, at any time. Habituation occurs in over all 5 senses. It's just the brain being unable to respond and hold in conscious awareness all of the sensation that's imposing on it at any given time. The brain has to make a choice about what's important and what's not important. And what's important is admitted into consciousness, and what's not important is ignored through habituation.
So that natural process is really going to help people with the tinnitus distress.
It is. This is why we can sit in a crowded restaurant and not notice the crowd noise and be able to focus just on the conversation at our table. That noise hasn't reduced in volume, but we're not noticing it. We're not aware of it. We can habituate to as I said, all 5 senses. If you wear eyeglasses, when was the last time you were persistently distracted by the frames? We routinely habituate to the visual background that surrounds our viewing screens. We habituate to sense. Even sounds as loud and unpredictable as passing trains and overhead flight patterns. And we can habituate to the sounds and sensations of tinnitus. So in the absence of a cure, screening tinnitus out through habituation is the best hope for a full valued life with tinnitus. As I said, it's an automatic process that occurs naturally over about 6 to 18 months. And there's about a 98% probability that people with tinnitus will arrive at that place.
So if I started having tinnitus and I'm having a lot of distress, if I don't do anything special, 6 to 18 months, chances are I'm going to be feeling a lot better.
Yes, it's more about what you should not do than what you should do to habituate, and we'll get into that in a minute. Because again, if habituation is so predictable, as Neil, you're correctly suggesting, then why do people become so distressed? Some severely and even persistently over years. So there's a certain portion of people with tinnitus who do not habituate and just remain distressed with it. The answer to this question will bring us to what happens in the brain that interferes with habituation. So we're going to do a little neuroscience now. It's not surprising that so many people have an emotional reaction to tinnitus because our brains are pre-wired to react with anxious attention to unexplained sound. And this is a survival mechanism that's left over from, a time when rustling leaves, the snap of a twig, the call of a bird could signal danger, and a quick response could spell the difference between life and death. And tinnitus is genuinely stressful, as we've seen, and it's the sound for some, in addition the sensations and possible hearing loss. The brain is screening all sounds that are presented to it to determine their importance. Are they beneficial or harmful, or can they be safely ignored through habituation? And for people with tinnitus distress, their brains have responded as if tinnitus is a threat and have sounded the alarm. And this adaptive alarm typically takes the form of anxiety, which is very reflexive and designed to motivate a quick response to avoid the threat or gain control of the threat. Anxiety involves three processes. Reflexive negative thinking, worst case scenario thinking, is designed to predict and help us plan for what could go wrong. Hypervigilance is a close monitoring of the threat. And anxiety produces strong drives to escape and avoid the threat by fleeing or gaining control over the threat. So what happens next? This is really the critical point that we were referring to a moment ago, Neil, is your response. What do you do with your tinnitus? And what do you do with the emotional experience that it triggers? Now, what you see is that people with tinnitus, and this is what I'm saying before, it's kind of not what you do, but what you want to not do. But people with tinnitus distress tend to subject their tinnitus to close surveillance, hypervigilance. They avoid loud settings they believe could make their tinnitus worse. They avoid quiet settings where their tinnitus is maybe more difficult to mask out. They avoid tinnitus-related emotions through numbing with drugs or alcohol. They ruminate on past actions they believe may have caused tinnitus, anticipate future disability due to tinnitus, manipulate factors they believe influence tinnitus, or constantly trying to get control of it. And they spend countless hours and dollars in search of the hidden switch they pray will turn their tinnitus off.
And I remember you're heading for this section, wasn't it, tinnitus resistance?
There it is.
Yeah, oh my goodness, yeah.
Yeah.
So all of those ideas, all of those things that you said are things not to do, all have that in common, where I'm trying to resist the tinnitus, trying to avoid situations that are going to bring it up more, or might seem to bring it up more, try to find ways to get rid of it, and that's not helping me.
Yeah, now it's completely understandable. My heart goes out to those folks, and I've been there. But unfortunately, tinnitus resistance carries an unwanted consequence. It blocks habituation.
Oh, so it's actually preventing or delaying my getting better.
It actually is. By placing tinnitus front and center as the driving force behind all of your thoughts and actions, you're reinforcing your emotional brain's association with tinnitus as a dangerous threat. And that sets up, whoops, that sets up what I call the tinnitus trap.
Oh, I like that. Around and
Yeah,
around I go.
around and around you go.
Whereas habituation is very different. Habituation is I'm not trying to resist it, and eventually, in a way, I get bored.
That's exactly right. Eventually the brain gets bored. It's able to predict the sound, so it's not anticipating potential danger anymore. And again, even if the tinnitus is intermittent, as I described before, it tends to vary within a certain range. And again, the brain can accommodate to that, get used to it, so to speak, and again, no longer associate it with danger or threat. And at that point, the brain stops sounding the alarm, and the result is habituation.
So what we want is habituation, not resistance.
Correct. So for those of you who may not know about cognitive behavior therapy, it's been around for several decades. It's probably one of, if not the most widely used form of psychotherapy in the world. It's considered a type of talk therapy. However, it's very different than traditional talk therapy because it's practical, goal-oriented, and teaches you how to handle problems independently. CBT has become the psychotherapy of choice for common emotional disorders like anxiety and depression. It rivals medications for treatment of insomnia. And as I had said earlier, CBT is the only clinically proven treatment to help people with tinnitus distress. Here are some endorsements for CBT. On reviewing cognitive behavioral studies, the Cochrane Group concluded that CBT for tinnitus provides significant improvement in the quality of life, a positive effect on the way in which people cope with tinnitus. A review of CBT research published in the American Academy of Audiology concluded that CBT is the most evidence-based treatment option so far for tinnitus. The evidence was found to be robust enough to guide clinical practice. And based on these findings and their clinical practice guidelines, the American Academy of Otolaryngology, and that's the ENT doctors, concluded clinicians should recommend CBT to patients with persistent, bothersome tinnitus.
So, Dr. Hubbard, if I have tinnitus distress, would the reason to take advantage of CBT be to start getting some relief a lot sooner than just if I wait for that 6 months to 18 months for the habituation to kick in on its own?
Yeah, there are a couple of categories of people, and I'm not saying this based on any research that I'm aware of. I'm saying this based on my clinical experience, that there are some people who come in much under the conditions that you're describing, Neil, who eventually, I believe, will habituate on their own. But I'm able to share with them some of these principles and some of the techniques that I'm going to be going over with you. And that I expect will speed the process along for them. So I think that that could save them literally months of distress by just getting some of this information, understanding some of these facts, really even understanding what habituation is and that it's possible for them, gives them some hope and some reassurance and helps them get their mind off their tinnitus sooner. Then there's another group of people, I think a smaller group, who have a history of emotional disorders, so they have that propensity. They have the propensity to become hypervigilant of threat and to think negatively and to withdraw and avoid. And those people are in much greater risk of being in that 2 to 3% that I had described before of people who really don't seem to habituate. And I think getting those people CBT knowledge and skills early on, and as we'll talk about later, getting them very often a more comprehensive treatment for emotional disorder, including medication and so on. I think that will really, give them the chance of preventing a longer-term problem.
Great.
So we can think of CBT, to understand what this is, as physical therapy for the brain. It's a coordinated program of exercises, or what we call skills, ways of thinking, paying attention, and taking action that reduce emotional reactivity to tinnitus, reduce the emotional reaction, the intensity, the distress, redirect attention away from tinnitus, so that addresses the hypervigilance, the constant monitoring of tinnitus, and motivate the courageous action, and it really does take courage to rejoin your life even with tinnitus. And all of these strategies create conditions that set the stage for habituation. So CBT is based on the finding that it's not just tinnitus characteristics. In fact, some studies show that tinnitus volume is not related to the level of tinnitus distress, surprisingly, which really put the focus on the person's emotional response, their coping response. How are they handling their tinnitus in the ways that we've been talking about? And that's what ultimately defines a person's level of distress. So in CBT, it's not what tinnitus does. And again, we're not treating the tinnitus itself. We're not expecting the tinnitus characteristics to change. But it's what you do that matters. How you respond to your tinnitus will determine your emotional course. As we've seen, a tinnitus-resistant response will reinforce your brain's association with tinnitus and danger and block habituation. A neutral response to tinnitus, on the other hand, will weaken the association between tinnitus and danger and send your emotional brain the message, tinnitus is not important. Turn off the alarm. The result is reduced emotional reactivity, what psychologists call desensitization, and reduced tinnitus awareness, also known as habituation. So CBT is designed to help you craft a neutral response to your tinnitus. To treat tinnitus as an unimportant, meaningless sound, a false alarm, a paper tiger. So we're trying to get from this to this. CBT skills can be learned. Again, the brain is like a muscle. Think of this as physical therapy for the brain, and the brain responds well to regular exercise. They improve with practice. CBT skills are practiced formally, where you set time aside each day to concentrate on a particular exercise. But the ultimate goal is to have tools that you can apply to live your life, that you can apply when you're out in the real world as the need arises to help you cope. CBT is rarely a quick fix, but it often requires commitment over weeks and months until your new skills become familiar and automatic. So there are 4 categories of CBT skills that I'm going to review. The first is careful thinking, mindfulness, therapeutic use of sound, and courageous action. Perhaps the most fundamental CBT skill set is careful thinking, what's sometimes called cognitive restructuring or cognitive therapy. Careful thinking is based on the finding that thoughts have a strong influence over emotions. If you're having thoughts about tinnitus that are driving distress, you'll really want to take the time and effort to step back and be certain those thoughts are accurate and reasonable. The goal of careful thinking is to develop and apply a recovery perspective on your tinnitus. that people can and do adapt to tinnitus, and there's a high probability that you can too.
In fact, maybe 98%
That's what
chance.
we're hoping. That's what we're hoping. There are several common ways of thinking that drive tinnitus distress, and the first step in careful thinking is to take a look at your own thought process and identify whether you're using any of these patterns. The first is probability estimation. Here you tend to overestimate the negatives and underestimate the positives, sometimes called catastrophizing. People tend to anticipate a negative outcome. I'm sorry, this is probability overestimation now. Catastrophizing, where people tend to overestimate the probability of the worst possible outcome, the worst case scenario. Because of tinnitus, I will become deaf, crazy, disabled. And you can imagine that if someone really believes this, that's going to be very distressing, very disarming and discouraging. You simultaneously underestimate the probability that you can cope with challenges that might arise. For example, I will probably be in the 2% who don't habituate. I can't tell you how often I hear this in my office and then see these people go on and do fine. And you overestimate the probability that through persistent problem solving you can gain control over tinnitus. And as I had indicated before, this is really one of the strong impulses that people with tinnitus have, is to try to persistently research and study their tinnitus. They spend a lot of time on the internet looking up experimental treatments and things like that. They spend a lot of time and attention to modifying diet and lifestyle in hopes of reducing the volume of their tinnitus. And they try every available supposed remedy to, again, to treat, to cure the tinnitus.
So these are examples of resistance, in a way.
Yes. Yeah, and it's based on the probability error that I probably, if I keep trying, I can find a way to control my tinnitus.
I'll be the
And
only one
again,
that ever did.
well, again, what I say is if there were a treatment for tinnitus, your doctor would want to know about it. He or she would want to make that available to you. They want to help. So the fact that they're not offering it is a pretty good indication that it's not out there. Another common pattern that drives tinnitus distress is all or none thinking. Here you see things in black and white categories and neglect to consider the more likely shades of gray. I will never adapt to tinnitus. If I have tinnitus, I will always suffer. With tinnitus, I will never be at my best. Because of tinnitus, my entire life is ruined.
And all these are really good examples of, like you said, all or nothing, black or white kinds of thinking.
Mm-hmm. When you see these absolute terms like never, always, entire, then you have an example of all or none thinking. So in evaluating these harmful patterns, CBT is based on the premise that thoughts are not facts. Thoughts are interpretations of your experience that can be heavily biased and driven by your emotional reaction to tinnitus. So despite what your mind is telling you, you cannot predict the future. No one can. In careful thinking, you'll learn to rely on facts rather than horror stories and bad advice to form reasonable, hopeful expectations about a future with tinnitus. There's a lot of bad information out there and a lot of horror stories, and as I said, people with tinnitus distress spend a lot of time on the internet uncovering all of these stories. So CBT recommends a careful review of the actual facts about tinnitus and habituation, and here are a few. Tinnitus is not life-threatening. Tinnitus does not inevitably get louder over time, nor do you, unless, if you with typical tinnitus, do you have progressive hearing loss. At present, tinnitus is not a treatable condition. The brain can adapt to tinnitus through habituation. Studies indicate 98% of people eventually do.
That to me is just remarkable. I know you've given that statistic several times, but I just want to take that in, that habituation process, it does take time, but it's a very powerful process that happens.
That's the single most important fact for people with tinnitus distress to embrace. And it's important to understand, too, that over that 6 to 18 months or however long it takes, it's not going to be a straight course. It's not all or none. It occurs gradually. It occurs in fits and starts. There are often setbacks. So again, it's really important to stick with it. And, when you get discouraged, to pick yourself up and get out there and try again.
So those ups and downs that people might experience, that's still the natural process of habituation that's happening. It just takes time.
It absolutely is, yeah. And again, I may have indicated this before, but habituation does not change tinnitus characteristics. Though subjectively, it seems like the volume of the tinnitus changes. And it's also because, again, much of what people are responding to is also their emotional reaction to tinnitus. There's a real fear of fear process that goes on where you feel yourself in a distressed state, so you believe that you will always be distressed. Your recovery can be aided by understanding some facts about emotion. So tinnitus distress stems from an emotional reaction. Emotional reactions motivate impulses to avoid and control threats, so that's what you're feeling if you have tinnitus distress and are determined to get rid of it. Emotional reactions can be false alarms. Tinnitus is not dangerous. It can be annoying and upsetting, but ultimately it's not dangerous. It's a false alarm, a paper tiger. Avoidance prolongs negative emotions, and acceptance reduces emotional intensity and duration over time. And in developing a pro-recovery perspective, it's also important to include the evidence from your own personal experience. And this is evidence that people tend to neglect. Many people with tinnitus distress will dismiss, for example, that during periods of their session with me, there were periods where they weren't thinking about their tinnitus. Or if I ask them, this is a common assessment to get a gauge on how people are doing with their tinnitus distress, is what percentage of the time would you estimate you're paying attention to tinnitus of your waking day? And they'll give you a rough estimate, 70%, 50%, 90%. And someone might say 70, 80%, which indicates that, okay, 20 or 30% of the day they were not thinking about tinnitus. That doesn't mean they were jumping for joy, but they weren't thinking about their tinnitus or hearing their tinnitus, and that is evidence that they're habituating and that they're on the way toward their recovery. So it's very important for people to take that into account. And also, if you ask people about their histories of dealing with other stress and trauma, they've been through a lot and come out the other side. So you want to really draw on that past experience of success and apply that to their experience with tinnitus distress. And then it's also, in a careful thinking context, helpful for people to learn of others who have habituated and not just habituated, but have gone on to have good, healthy, full lives, even though they still have chronic tinnitus. It's still at the same level. So because I've been through the process, I do routinely disclose that with my patients, and they seem to be very, very appreciative of that. And here's, just to give you an example, a short list of celebrities who have all disclosed that they have tinnitus and have spoken about it publicly, who have gone on to have really, terrific careers. So here's a traditional worksheet we use in cognitive behavior therapy called a thought record. And a thought record is used to track and evaluate your thoughts and come away with more reasonable, effective ways of thinking about the problem. So you first take a look at, okay, what's the situation in which I'm feeling distressed? What are my spontaneous thoughts that are arising in that situation? And then here's where you put your spontaneous thoughts to the test, where you really step back and ask, is this a reasonable way for me to be thinking? What evidence supports this idea that I'm having? And are there any facts or real probabilities that contradict it? And what's a more reasonable way to think about this that might help lower my emotional distress and instill some hope? So here's an example, and this is, of course, the most common trigger for tinnitus distress is hearing tinnitus. And the most common response is, I can never adapt to this.
So there's the all or nothing thinking that you were talking about.
There's that word.
Never's
There's
a
that
clue
word,
to
never.
that all or nothing thinking.
Yeah. And so here's just one potential response, having thought through this and taken the actual facts and evidence into account, is this hurts now, but I've had periods like last night with my kids when I forgot about tinnitus. Habituation is gradual and time is on my side.
So actually writing out an alternative thought like that could be a way of doing this part of the CBT.
Writing it out, and as we'll see in a few minutes, taking it with you and reminding yourself of it throughout the day, absolutely. Here's another example, feeling anxious and depressed. If I feel this way now, I can never be happy and productive again. There's no reason to believe that my brain is any different from the brains of millions of others who have already habituated to their tinnitus. Now, the persistent, uncontrollable nature of tinnitus, which I had referred to before, is probably the single most difficult fact for people with tinnitus distress to handle. And in recent years, acceptance strategies have become a core part of cognitive behavior therapy. And many of us are familiar with this wisdom through the popular Serenity Creed. Grant me the serenity to accept the things I can't change, like tinnitus, the courage to change what I can, like my response to tinnitus, and the wisdom to know the difference. So acceptance is a practical process of taking a careful inventory about what you can and can't change about your present situation. And this helps reduce distress from trying to change tinnitus, from continuing to fight and brace against tinnitus. And that energy and attention can then be redirected toward things that you actually can change, like your response to tinnitus. And here's a worksheet, I'll go over this quickly, where I asked people to write out all of the problems that they're having in relation to tinnitus and to their emotional reaction. And then once they've written that list out, they go back with each item and ask themselves, is this something that I can change? Or is it something that I would better work on accepting? Maybe it's something that I can change, but I can't change right now, so I'm going to accept it for the moment. So here's an example. Again, tinnitus sounds is something we can't change, and it's really most practical and rational response is to practice accepting them. Feelings of anxiety, something we can't change immediately, but we can set the stage to and behave and think in ways that eventually can reduce the anxiety. So that's an accept for now. Negative expectations about life with tinnitus, that's something that you can work on changing in the moment. Avoiding situations that include crowd noise that you fear may make your tinnitus worse, that's something you can change. So here are some important points to consider regarding acceptance. Acceptance is not approval. You're not approving of tinnitus by accepting it. You're not making friends with tinnitus. You don't have to be positive about your tinnitus or like your tinnitus to accept it. And it's not an all or none process, but a process that occurs gradually over time. So the final step in self-coaching is really developing an effective inner voice. We're always talking to ourselves. We're commenting on our experience as it occurs. We're encouraging ourselves, guiding ourselves in different directions. And as we've seen, the inner voice of someone with tinnitus distress tends to be pretty critical and really feed a gloom and doom message about tinnitus. So what we're trying to do is take the results of the careful thinking so far and encourage and develop an inner voice that encourages hope and guides the steps needed for recovery. So this is really about having developed your new perspective and then applying it. And one way to do this is what I call a recovery statement. A recovery statement sums up your personal takeaways from your careful thinking. It's something you actually write down with a set of sentences, keep it with you, and review it throughout the day to provide some reassurance and some encouragement. So here's an example. Okay, maybe this condition won't go away, but the chances are high that over time I will learn to live with it, adjust to it, screen it out. And I certainly hope my tinnitus doesn't get worse, but I refuse to let my brain what-if me to death. I choose to live, so here I go. It's one thing to conclude rationally that the best thing to do is accept your tinnitus, yet it's quite another thing to accept tinnitus in your direct experience, in your heart of hearts. Mindfulness is the primary acceptance strategy used in cognitive behavior therapy. Mindfulness is used widely in CBT to promote acceptance of unwanted, uncontrollable realities that life is full of, like tinnitus. Mindfulness helps defuse from tinnitus and emotion, disentangle your inner self from tinnitus and from your emotional reaction to tinnitus. And it's used to practice broadening your attention away from tinnitus. So again, here's where you're practicing relaxing your hypervigilance and letting go of that anxious, vigilant attention to tinnitus. In practice, mindfulness is about developing non-judgmental objective attention. Non-judgmental stance toward unwanted parts of your experience you can't control, like tinnitus, like your emotional reaction, like the circumstances that have been triggered. And I want to emphasize that it's not that you won't have negative judgments about tinnitus, you will. But mindfulness is the practice of noticing those judgments and practicing not getting pulled into them, not getting tangled up with them and with the associated thoughts. And mindfulness is the practice of present-centered attention. You're staying in the moment with whatever is occurring without straying into the past memories or future expectations. You practice relating to your experience, to tinnitus, and to your emotions in an open and accepting manner. We're pretty good as humans at changing things that when they're not the way we want them. We're not so good at accepting the things that we can't change. And essentially, mindfulness is the practice of allowing your experience to unfold exactly as it will, and here's the catch, even if it's not what you want. So here's the situation where you don't want tinnitus, you don't want the emotional impact that it's had on your life, but as we've seen, these are not circumstances that you have direct control over, that you can change. And so mindfulness is an opportunity to set your timer and sit down for 10 or 20 minutes and practice just allowing these experiences to exist. Facing tinnitus in this way is a profound act of courage. Specific strategies are used to ease the way. You'll practice deliberately broadening your attention out from tinnitus to include soothing sounds and sensations as something other than tinnitus on which to anchor your attention. So you practice, we use breathing very often for this, just the sensations of breathing. So someone sits down quietly for 10 minutes and their attention is just going to go like a magnet to their tinnitus and to how awful it is and how their life has been so negatively affected. And with mindfulness, you're going to practice broadening your attention out to include the sensations of, it's just something very simple and rhythmic, the breath going in and out of your body, the contact points of your body against surfaces, and other sounds, soothing sounds, as we'll see. Background sound is a very important part of helping people with tinnitus. So that would be something that you would play while you were practicing mindfulness, and watching your tinnitus in this objective, non-judgmental manner, trying to be open and accepting, and broadening your attention out to these other simple sensory anchors like breathing. We also use relaxation strategies as part of mindfulness practice, and these strategies have been part of cognitive behavior therapy for many, many years, and specifically a part of a strategy to reduce emotional reaction to tinnitus. But I think they're best used as in a mindfulness context, where not only are you letting go and allowing and accepting at a mental level, but you're also letting go at a muscular level, and that's what relaxation strategies do. So we use abdominal breathing and progressive muscle relaxation, which are, again, very common exercises. It's also very helpful to really get a much more concrete set of sensations to broaden your attention out to when you're practicing mindfulness with tinnitus. So we use stretching and yoga. And as I mentioned, therapeutic background sound, which we'll talk about in a moment, is a very important adjunct. So therapeutic sound with tinnitus is probably the oldest and most commonly used strategy to soften the effect of tinnitus. And there are a number of different ways to use sound, but I'm going to talk about the most common, which is background sound. Also known as masking, and we'll talk about that in a minute because you have to be careful in how you use it. But this is based on the premise that you can't change tinnitus, but you can alter the background against which tinnitus is heard. And that reduces the perceptual contrast between tinnitus and external sound, and essentially confuses your brain as to which is which, so that the tinnitus subjectively tends to blend into the background. Now, this is kind of a complicated, but for some people it's a very simple process to find an effective background sound that they can use to soften the perceptual effect of their tinnitus. For others it's pretty tricky, but there are a lot of ways to do it and a lot of options out there now. Now another point to make is that if you go to an audiologist, this is what they'll do, and I'll show you in a minute. They prescribe and fit people with in-ear noise generators that are used to create this sound. We'll talk about that in a minute. But in CBT, and I'm sorry, you're going to say the audiologists tend to recommend that people leave this sound on 24/7 if they can, so that they're never exposed to their tinnitus alone. We don't take that approach in CBT. We use background sound more strategically at the times of the day when people need it most, say for concentration or for sleep. Now here I can give you an example of what tinnitus sounds like with a mask. I'm just going to unmute my phone. So you're going to hear tinnitus, and then you're going to hear a mask fade in. And just give that a few moments to see what, as you're hearing it, what the effect of the mask is on the tinnitus.
So it distracted me quite a bit from the tinnitus sound.
It did. Yeah, good. That's what we're looking for with a good background sound. And um, that, by the way, is there are a number of different types of sounds. I said that's an environmental soundtrack, which is probably one of the most common. And it's one that includes a lot of high-frequency sounds, and that was high-frequency tinnitus. So you're looking with a mask for sounds that are going to almost cancel out the sound of the tinnitus because they're very similar in register. And you can see here, this is among my patients, this is the most common form of masking. But these tabletop devices are also available, and they cost about $20, and you can see they have a number of different types of sounds on them. Most of these are devices, as with the sleep app. There are a number of apps now where you can get quite a bit of control over mixing different sounds, and there are just literally hundreds of different sounds available. And this app, I think, and this is the case with most of them, is designed for sleep, to have sounds that people can put on, not with tinnitus necessarily, but just anyone who wants a soothing background sound to help them fall asleep. Here's I'm
I have
sorry,
a
Neil,
question,
go ahead.
Dr. Hubbard.
Yes.
Sorry to interrupt. So I can see where the therapeutic sound would reduce my distress, but I'm wondering, is that going to interfere with my habituation over time?
Beautiful question. And as I had said, you have to be careful in how you use therapeutic background sound and how you set the volume and how frequently you use it. So in cognitive behavior therapy, our approach is to give people tools to help them listen to their tinnitus effectively and to be able to let go of their tinnitus and shift their attention onto more important areas of their life. Um, Background sound is something you can really get dependent on. If anybody out there understands CBT for anxiety disorders in general, this would be a major safety signal. And so it's something it's okay to use. It's an effective coping skill, but you want to, like with benzodiazepines is another example for anxiety, you want to use them in a cautious, strategic manner and not round the clock every day. So there are some people who I think do need these in-ear sound generators because they're that distressed by their tinnitus. That it's really helpful and important for them to have that sound coming in. But it's something that you want to, and we're going to talk about this in a moment, at some point suck it up and carefully wean yourself off of. So that's in CBT, that is part of the process. We want to make background sound available to people because it can be very helpful for them. But we want also for them to use it cautiously and to be able to wean off of it. And just to get back to your specific point, Neil, you'd want to set the volume of the background sound low enough that you can still hear your tinnitus. because that is still providing your brain with some exposure to the tinnitus so that your brain can be learning that the tinnitus is not important, and that will promote desensitization, which promotes habituation.
That makes a lot of sense.
Um, Now, as I said, one of the toughest times for people with tinnitus is sleeping. Falling asleep, and then often if they do fall asleep, they'll wake up in the middle of the night, hear the tinnitus, and it triggers an emotional reaction. They're just wide awake again. So there are various methods of providing background sound during sleep, which is a very important time to use it. And this, in my opinion, is the best way to go. You can see what she's wearing that looks like something to keep her warm when she's outside in the winter, is actually a set of headphones with tiny little unobtrusive speakers that are centered right over her ears. And even to take it a step further, you can find these that are wireless, so that you don't have a wire connecting you, and you really are free to just kind of move through the sleep positions that are comfortable for you, and to have a steady stream of a soothing masking sound to help you sleep. And again, I encourage people to do this if they're having trouble sleeping. If they don't need it, I don't encourage it. You know, and then we're careful to wean off this type of help as part of the course of therapy. CBT is ultimately about taking the courageous action where it's needed most, on the proving ground of your life. And recovery from tinnitus distress means fully rejoining your life, resuming all of the activities that bring meaning and value for you. So I call this courageous action to rejoin your life. It does take a lot of courage. If any of you are familiar with anxiety disorders, this is the exposure phase of treatment, where you commit to carefully taking back whatever you've lost in your life due to avoidance, to not experience anxiety. So taking courageous action to rejoin your life is the surest way to show your emotional brain that tinnitus is not a threat. If I can go out and live my life, and I can do these things, and I can go into settings where there may be loud crowd noise and so forth, then tinnitus must not be very important. And again, you're giving your emotional brain the message that tinnitus is not important. It's a false alarm.
Now, if I'm doing something difficult, like say going to some noisy place, like a noisy restaurant or something that I've been avoiding, in the short run, could that increase my distress?
It could increase your distress. We'll talk about that in a minute, but yes, it could. And again, this is why, this is a perfect slide for that question. Courage is not the absence of fear. Courage is feeling the fear and doing it anyway. And so this phase of treatment is about uh, 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 drawing on the tools that you've learned previously in CBT, your careful thinking and your mindfulness and relaxation, to make it easier to enter into these settings. And we'll talk about some other strategies to make this more achievable for people. As I said, this is really the exposure phase of CBT for tinnitus distress. Exposure is the backbone of cognitive behavior therapy for emotional disorders, and it's probably one of the most reliable treatment strategies across mental health approaches. Exposure works by putting you into the situations where you're providing your brain, as I said, with the opportunity to learn that tinnitus is a false alarm. Avoidance, which is typical with tinnitus distress, we believe prolongs the process of distress and prevents habituation by the widespread avoidance associated with it. So you're avoiding going into these settings, and again, that removes the opportunity for your brain to learn that tinnitus is not dangerous and to stop sounding the alarm and to screen it out. again, as I said, we have strategies to make this easier and achievable for people. So you don't dive in all at once. You take a graded approach.
So I
And
might start out doing activities that I've been avoiding, but they're smaller steps for me, so they're more manageable to do.
yes. And I'm sorry, as I said here, you're applying your careful thinking and mindfulness to soften the experience and help you sustain it. Um, so it's a gradual approach, and here are the areas that people with tinnitus distress have been avoiding, that they're going to gradually approach now. And first and foremost is just having exposure to the tinnitus sounds. And so it's, people have been largely avoiding, silence is a strong word, but because there's typically some level of background sound wherever we go, but avoiding sitting in areas that are not noisy enough that their tinnitus is at least partially masked out. So weaning off background sound, as I said earlier, is an important part of this process. Phonophobia, the fear of sound, is the word that we use to describe what I've been talking about, where people become literally afraid of certain settings because of the sound that they produce. And so being able to gradually enter into settings with safe but loud levels of sound is a very important part of exposure and recovery. And I haven't talked about it yet, but another thing that people with tinnitus distress often do in order to avoid their concern that the settings could make their tinnitus worse is by overusing hearing protection, earplugs, ear muffs, noise cancellation headphones, things like that. So weaning off unnecessary hearing protection is another part of fully rejoining your life and taking it back. So this is what you were alluding to before, Neil. This is what I call an activation hierarchy or an exposure hierarchy. And this, again, is a common tool in cognitive behavior therapy with emotional disorders that we're using here to help people with tinnitus distress. So the way that this worksheet works is we have people write down all of the areas that they're avoiding because of their emotional reaction and because of their tinnitus. We have them estimate the level of emotional intensity associated with those settings, and then rank order those from easiest to hardest. Here it just goes up 1 to 4, but typically we'd have 10 or 12 or even more items on this list that have been rank ordered.
So the idea is that I'm gradually starting to do things that I've been avoiding in manageable steps, and that's a really important part of the CBT.
It is. To use an exercise analogy, if you were out of shape, you wouldn't go into a gymnasium and go straight to the 250-pound weights. You would go to the weights that felt right for you, the level of weight that would challenge you. You don't want it to be too easy because you want your brain to actually learn. You want your muscles to learn in that case, but you don't want it to be so heavy that it's going to overwhelm you and you won't be able to focus on the exercise. So that's what we're looking for here in terms of the emotional intensity, is having people start at a level that they feel is achievable, that using their new coping skills they would be able to accomplish. Again, and not that it's going to feel great for them, but as you pointed out earlier, Neil, the emotion may go up and become stronger in the short term, but in the long term, there's lots and lots of evidence and lots of people to attest to the benefit of this kind of process in reducing the emotional distress over time, so that it becomes just, again, like going into a gym. and starting to work out with weights, you start with the weight that's right for you, and after a couple of weeks that starts to get easy, and you then take it up to the next level of weight. So here's an example here of someone who feels the first step for them is to go to the cafe with a friend using their earplugs. And this is, again, where I would allow this strategically to get them started, to get them. This may have been a person who's hiding out in their home for weeks or months because they're afraid to be exposed to crowd sound, even the low murmur level that would occur in a Starbucks or something like that. So this would be a way for them to get started in reversing the avoidance and approaching these settings and beginning that process of taking their life back. So once they've done this a few times, whoops, I went backwards. They would then practice going to the cafe without earplugs. So there's a higher level of exposure, and they'd be ready for that. To take it up to the next level, maybe they'd go to the movie theater using earplugs. To take it up again would be, for example, to sleep with no background sound, just using their mindfulness, relaxation, and careful thinking to help ground their emotional reaction, let go of the tinnitus, and be able to drift off to sleep. Now, an important part of rejoining your life is learning how to use safe listening. How to practice safe listening. We wouldn't think of going to the beach without sunglasses and a bottle of sunscreen, but people routinely engage in all kinds of really dangerously loud activities without hearing protection. And here's just an example of the many activities people routinely engage in and don't think about their hearing. So my rule of thumb is if you're in a setting where you have to shout to be heard, you're probably damaging your hearing. And so you do want people to learn to practice a careful use of hearing protection, not overdo it. And here's just an example of the many, many types of hearing protection that are available now, including those clear-looking earplug things with the little round opening on it, sitting on some wood. Those are custom fit earplugs that have been molded to someone's hearing canal, and that little circle that says 15 on it is a filter that can be removed and replaced. That's a 15 decibel reduction, and those typically go up to about 30 decibels of reduction. So 15 would allow you to go into a setting like a concert or a movie theater and still be able to hear relatively well and communicate with the people around you while protecting your hearing. I had referred to earbuds quite a bit earlier and had mentioned that there's concern that earbuds have really done a lot to damage people's hearing. We do not recommend the use of earbuds. What earbuds do is they push the sound source right up toward the eardrum, and they lack any kind of baffle to reduce external sound. So in order to hear the signal through earbuds, the music you're listening to or the audiobook or whatever it is, you've got to really turn up the volume of your sound source in order to block out any external sound that's occurring around you. What we recommend instead is over-ear headphones like these. Your ear actually fits into that completely so that the padding is right up against your head, completely enclosing your ear. And if you are willing to spend a little more, you can get noise cancellation technology, which allows you to reduce the background sound even more. So your signal's not competing with the background, and you can turn it down. So this is the best way to be exposed to music or any kind of audio signal directly, personally into your ears. So the final part of CBT is to practice applying your new skills. As I said, this is an important part of taking courageous action to gradually rejoin your life. That at those moments when you're willingly, deliberately entering into a situation that may trigger a strong emotional reaction, you can use your recovery statement, you can use your mindfulness, you can use some soothing breathing, and practice broadening your attention out from tinnitus and out from your worried thoughts and concerns and onto the activity around you, onto the task at hand. So what I recommend for this is a acronym I call CRAFT. Now a craft is a set of skills used to create something new, so that applies nicely here. And a craft is also a vessel used to facilitate travel from one place to another, so that fits our need here as well. So the C is to catch your resistant response. Remind yourself this response is not helping, it just keeps you trapped with tinnitus. Apply your new response. Follow up with practice. And take heart, because here it is again, Neil. 98% of people with tinnitus go on and habituate, and you can too.
I want to encourage our viewers to pause the video and write these down. These are wonderful.
So in my field, we talk about what we call an evidence to practice gap. And that's where there's research that has been used to develop a particular treatment for a particular problem. It's been shown to be very effective in helping people with that problem. So there's a wide range of people who could potentially benefit, who need the treatment, but there are no practitioners providing the treatment. And I'm afraid to say that's the case here with CBT for tinnitus. There's just been a wonderful, wonderful work done over several decades now on developing this approach, developing all the strategies that I've described here in this webinar. Yet the number of practicing clinicians, if you can even see it here on the screen, I'll highlight it for you, is unfortunately very, very small. So we talk about an evidence to practice gap. I'm afraid here with CBT for tinnitus, it's an evidence to practice chasm. So this is part of my mission, is to inform and educate other clinicians about the importance of helping people with this problem. So where to find help? There are varying degrees of help required, and the first for people with mild tinnitus distress would be health education, or just really, viewing this webinar and learning about habituation and about the steps people take to block habituation and what they can do to promote it, and self-help resources. And we'll refer to it in a moment, but I have a website that has a lot of educational material on it and self-help resources. People with moderate tinnitus distress could probably benefit from a brief course of CBT, self-help, and possibly medication. What I recommend to people, if they can't find a local CBT therapist who can provide an experienced course of treatment for them, then they would try to find a CBT local therapist who's interested in learning about tinnitus, watching this webinar, doing the readings that I have listed on my website, and get that person up to speed on how to help them. Then people with, the unfortunate 3% with really severe tinnitus distress would likely benefit from a full course of CBT, and typically those folks, I really do encourage them to use psychiatric medication, which can really, really facilitate the process for them in many cases. So here's my website. www.cbtfortinnitus.com, and this contains information and resources on tinnitus distress and cognitive behavior therapy. Then I would strongly encourage people to use the ADAA website, adaa.org, which has a treasure trove of information and resources on anxiety disorders and depression, and as Neil referred to earlier, an excellent Find a Therapist page. And then ABCT, that's the Association for Behavioral and Cognitive Therapies, abct.org, is a website that has information and resources on cognitive behavior therapy, and also an excellent Find a Therapist page.
Well, thank you so much, Dr. Hubbard. It just was a fabulous presentation. And I want to thank everybody for participating. And feel free to send in emails with questions that you have for Dr. Hubbard. You can send your email to webinars@adaa.org, and you can write tinnitus in the subject line. And here again is Dr. Hubbard's website, which is a wonderful resource, cbtfortinnitus.com. And finally, in closing, consider making a contribution to ADAA so we can continue these kinds of programs and the many other activities of ADAA. So bye for now, and we'll see you next time.